Welcome to Passport to Wellbeing, a map toward mental health and wellness. We are Personal Assistance Services, a standalone employee assistance program. Employers partner with us to provide free, confidential, emotional, and well-being support services for employees and their families. You will find more information at mypasseap.com, the MyPass app, or by calling 1-800-356-0845.
Hello and welcome to episode 3 of Passport to Wellbeing. This is Amy Mers. I'm your host today on the topic of child and adolescent mental health and also how PASS supports families in that mental health journey. Today I have with me Kevin Scobie, and he's one of our clinicians here at PASS and also has some extensive experience working with kids and teenagers. So Kevin, thanks for being here, first of all. Can you share a little bit about your experience and tell us what you do here at PASS?
Yes, well, thanks for having me on today. Like you said, I'm a clinician here at PASS. Prior to that, I've had a lot of history. I've really spent 20 plus years working with children a lot and families. Of course, they all go together, and really trauma-related kind of backgrounds, a lot of child abuse and neglect. I worked with the state for a little while, investigating that, supervising that. Then I spent a stint working in Children's Hospital in the trauma room, working with a variety of types of trauma, from, doing some interviews with children related to sexual and physical abuse, along with mental health and human trafficking, gunshots, you name it. I mean, all things falling underneath trauma. So that's kind of my background. And then, of course, just doing some clinical work where I do, some therapy with kids, adults, families, couples, you name it.
Wow, sounds like you've really seen it all. You've so much different kinds of experience working with families. So we're really grateful to have you here. This topic we decided to include in our podcast because we do get requests for family counseling and also families calling in for their young children and their teenagers. And so I wanted to share with our audience why this is an important topic. How have things changed over time? You have your 20 years experience. I'm also a clinician and have worked for 25 to 30 years and worked for a long time with just kids and families. And really the field has changed. I think it seems like there are more diagnoses, there's more kids accessing or seeking resources for mental health. Does that mean that kids today have more mental health problems, or what are you seeing is the difference?
Well, I mean, that is definitely a complicated question, and the answers that we're all trying to come up with on how we can support children. I would say, I agree in the last, even the 20 years, I've seen the writing on the wall, and then seeing how this has started to manifest even further in the mental health crisis with children. One of the big things I see is a very different component is we're really in a very technological world that's evolved very quickly, with a lot of information, which, it's got positive and negatives, but it's really information overload, and it requires a lot of processing for things that maybe we experience now that we would have had no knowledge about. And now we have to process that on an emotional level and some different things. And kids are exposed to that vicariously and all through content on the internet. We don't really have the regulations on content on the internet electronically. We used to do it with TV commercials. We understood the impact for kids. We're not there yet. I hope that we will, because it is so impactful. We're in an attention economy, like I said. So the goal is to pull attention, because they get money for advertisement dollars to attract people into paying attention to things without all these regulations. So I think, it's important with kids that with the electronic side, if we're not, I use the word balance a lot. If we're not balancing out our time on electronics, especially when we think about when we get into developments of children, they really need play to learn and experience. And when we put them in front of electronics, it's doing the thinking for them. It's stimulating them, and their brain pathways aren't developed for this, and it's very overstimulating. I think we've seen an increase of ADHD as a result of that. Another example I'll give on that, if your child is not developmentally developed yet for the emotional social of the content that they're getting ready to see. I put it like this: say they're watching a video online of puppy dogs. Well, it brings up this feeling that they may or may not be identified based on their age, but it brings happiness, right? But then within 5 seconds, they see another video of a tornado ripping through and ripping up houses that creates fear. As an adult, I can understand the difference in that. But as children, all they are having is this neuro response and all these activating events in their brain and neurosystem, and they don't know how to sync with that and understand it. So, of course, we're going to, with the exposure level, kids are going to have an increased sense of anxiety and different things that we've seen manifest. And I do believe it's a result of lack of parameters around that.
We could probably do a whole podcast episode on social media and kids. Maybe we will, maybe we should. In a nutshell, so obviously we could go way into the content, but are you saying that kids should not have exposure to screens? Are you saying, I know you said the word balance, and we are going to talk about developmental levels of, do you have just a one sentence general idea or guideline for parents, or?
Well, I think there's going to be a lot of debate on this one. So I would tell you that, especially that critical formation at 0 to 3,
Okay.
the importance of play as a interaction style of learning, where you got to use imagination and you got to do these things for a developmental play. That's so critical at that point. I mean, I just want the awareness that be careful on how much content and electronic stimulation you're giving them, because you are wiring a process, an imprinting default mechanism that may impact their self-reliance, their independence, their ability to think in that way, and process in that way. So I do think in the early parts, it's very critical. As they get older, I think it's you really have to be in charge of the regulating, because children aren't able to do that for themselves. So, really limiting screen time. And it's not just that, we got to do it as adults, right? We can't tell our children don't be on screen and then we're not present because we're always distracted and
Sure.
modeling this avoidant distracted behavior. So it's a real responsibility. So I would say, sure, can it be helpful? I mean, yes. What kind of content? Is it educational? There's so many factors into that. Yes, limiting that. We knew a lot of things about it, the blue light, the different things that are firing things, dopamine responses in our brain, different things that make us attracted to that, and impulsive nature with that. And kids just aren't developed to handle. And a lot of adults aren't even at that point. So that's what I would say to that.
Yeah, episode 2, what we talked about sleep. And I think that blue light and some of those screens can affect that too. I'll also say, what you're talking about is not simple. I mean, I am a clinician. I am aware of these things, but I find it very difficult to monitor social media and my kiddos' screen time. Anyway, like I said, we could probably get into that more in depth, but I also wanted to ask you about post-pandemic. So we talk about how things have changed. And again, we could also talk a whole episode about that. But what about post-pandemic and kids' mental health?
Well, COVID definitely accelerated our use of electronic and televideo. We used to promote, at certain less than 60 minutes. Well, that went by the wayside because now we were having children focused on a screen for video learning, and it totally blew up the whole, what we were trying to evolve in. The use of electronics has become an accelerated process that we are going to have a ripple effect from, because it takes time to adapt to these kind of things when we're talking about these significant jumps like this. And I just want to throw this in there on this is like, we have to recognize when we move so quickly into bringing things into our children and different things, and we haven't really taken the time to think about the long-term consequences, we have to really consider the algorithms that they're using to use you as an attention economy token to pull you in to get dollars. You have to be very aware of how addictive that is. These mechanisms understand our patterns more than we do sometimes. And kids who aren't that self-aware don't recognize that these kind of processes are attracting, they're almost pulling them in to become addicted in nature, to depend on that, to avoid, to distract, to numb. And we really have to watch the line of what is the purpose of what we're doing? Is it educational? Is it for enhancement? Or is it for some of these possibly maybe self-destructive things of that avoidant distractive kind of mechanisms and the numbing that can become a real problematic coping strategy that we can default into as children and adults?
Well, and you make great points about also how things got accelerated. And earlier you were talking about developmental stages that kids go through preschool and elementary school and adolescence. let's talk a little bit about those developmental stages. And you also talked about some of the needs that they have, whether that's through play, through intellectual development, cognitive stimulation, and also social development, because I think that's another thing that the pandemic affected. So, obviously a lot of people talk about that and their social development and technology in general. I don't want to only talk about technology, but social development also plays a part in some of what we're seeing with mental health in kids these days. So whatever direction you want to go in terms of development and what parents need to know about different stages, what ages their kids are.
Well, yeah, let's talk about that because, we know that with the COVID epidemic, it really disrupted a lot of that social emotional interaction with peers for certain age groups. It's important at the developmental level they're in. I'm going to get into some Erickson's life cycle stages of social emotional development and brain development because it's important to understand this, that, when they don't have these opportunities, not being in school, not having that one-on-one interactions with their peers and all that, that removed an ability for some developmental progress that was basically, unavailable. And so that creates some delays that we got to recognize, and that we're going to have to go backwards a little bit and teach some skills to children that we think they should have known by now, but we have to be sensitive and show some grace that they weren't given the same opportunity, and that this is a very impactful. And I'm a very trauma-based person. I mean, I know people don't always like that word, but I want to put it in a context that we are all traumatized in some way. This external thing that's happening can be impactful. We've all experienced some letdowns, emotional pain, suffering that we've had to overcome, be resilient, and do. When we're talking about brain development, I want to point out that I talk about 0 to 3 being the most critical time. It's the most imprinting, personality driven. It's a lot of defaulting of what we're based in. And we don't even remember it. It's very subconscious, right? We don't really typically have a lot of memories before age 3 that we even recall. So 0 to 3, we need to understand that from birth to age 1, the brain doubles in size by age 1. By age 3, it's 80% of its size. Birth to 5 develops more than any other time in our whole thing of our human experience. By age 5, our brain is 90% developed of the way that it is, with the brain not actually being done maturing. The prefrontal cortex part of our brain does not mature until around 25 years of age or so. So when we think about young and going up, their executive functioning center isn't actually developed maturely until 25. We think 18 is an adult. I want to change the narrative on that's not exactly right. And then by age 12, the brain stops growing in size. Your brain is as big as it's going to be, not all the connections, but it's as big as it's going to be by age 12. So that just tells you a little bit on the brain development side, how critical that is. Now, that being said, we're going to get into, when we think about ages and all of these kind of things, when we think about what children can do and they're capable of doing in this developmental process we're talking about, by 2 years of age, a child in a language sequencing can only really answer questions of like what and where. They don't know why. They don't have the abstract thinking. 2 to 3 years old, they may be able to do some who and maybe some designated why this and maybe, and 4 years old, you're getting into like when, how many, some more quantitative based kind of things. I really think that's important. And what we're asking of children, and the way we use our language with them, thinking about their brain development that goes into the language development and all these things that are building on itself for overall healthy development. So we go from there, and then we get into, like, I really like to touch on Erickson's life cycle stages on like social emotional, because it has to do with regulating emotions, impulse control, and things like that.
I just wanted to also mention, when you say Erickson, just for anybody who doesn't know, Erickson is a psychologist who studied human development. And so he's kind of the expert on child development. Okay.
And so, and one thing I want to say with that too, is that we're coming to realize this ability on social, emotional, and regulated emotion impulse may determine more success than IQ. We talk about emotional IQs and all of that, right? But we have not really, done the level of how important is it for us to be able to be emotionally regulated, to be in that relaxed state of being, so our prefrontal cortex can work and function at its highest degree. with Erickson, birth to 18 months, that cycle to that is, he calls it trust versus mistrust. And it really shapes our worldview and our personality. It's asking, that child's asking, can I trust the people around me? Safety, security, how do I build that? How, as a parent, can you do that? Affection, comfort, food. These are things that have to be done there so that a child develops into a very trusting world. This has a very big impact when we go to mistrust in that cycle stage. And as I talk about these, every time we're developmentally missing these targets, we got to go back at some point in our life to truly heal and be healthy in these sides.
What I saw, I've also seen in the education system, and talking to teachers, and also I'm a school board member, is we've worked post-pandemic to try to catch up with the academics that were lost, but we're seeing a lot of behavioral and emotional and social gaps, really what you're talking about, that have been impacted and may not have the same resources to catch those up too. Take me through that elementary age group when you're talking about markers. That made a lot of sense about that younger up to age 4, of very concrete and not abstract, and how that can affect our expectations of those kiddos and what we expose them to. Tell me about like K through 6.
Yeah, well, and I just wanted to touch real quick on that. I did do some work with special school, working with developmental, intellectual, whatever. And part of that issue was that chicken or egg. Do we need to teach children how to regulate emotionally so that they can be academically successful? Because how can you be academically successful if you're under duress, stress, anxiety, and I'm talking about prefrontal cortex not working right? So there's always this debate, the pressure of focusing on academic, but how can a child be successful academic if their social emotional learning is not where it needs to be? We're asking a lot for that. Think about emotional language, right? Of how we create that. 0 to 3 age of children, they can identify and start naming emotions, like simple ones like anger, fear, joy. They recognize that off of face recognition with their parent and all of that. I want you to think by 4 years of age, most children know about 300 to 500 words by age 4. At 4 to 5, they can start to identify more complex emotions like jealousy or embarrassment. These are all developmental things. 5 to 6 years of age, they learn to better regulate emotions, show empathy, follow simple rules and directions. And then about 7 to 8, they fully understand rules and can start to see thought, feeling, behavior connections and how that all plays out. Once you get into 9 years of age, the 9 to 10, the influence of peer and friends takes precedence.
Third and
So
fourth grade.
it's a very different kind of developmental shift at that point from the parent influence. Not saying they're not influential, but there's another pull here that's happening with the peer group and the relational level. That's a big thing on the emotional side of language. So when we're talking about talking to children and asking, putting language out there that is understandable to them, you can start to see why, if you're asking a 3-year-old, why are you angry? Well, I mean, they're at an age that they just identify a emotion named anger, much less to ask them why. Like, it's pretty abstract to be able to put it in together about why, that would be complicated, because really from 7 to 11, they're still concrete thinkers, right? They start to become aware of other people's feelings and start feeling like how that impacts theirs and all around. And really, it's not till about age 11 to 13 or so, there's nothing perfect on a number, but they become more abstract in thought and can see multiple meanings. So when we're trying to get a child to reflect somebody else's feelings or meaning before, say, 11 to 13, that's a pretty tall order when they don't know that. So I hope that answers that question as far as the language stuff of why that's just different in elementary as we go along, and what that looks like.
Yeah, it seems like also those are general ideas of ages, but then there are also kids who might mature at a different rate. They might be smart, but maybe socially less mature, or vice versa. I think also those, it's also going to be a family's individual experience with their kiddo. And even one kid in the family might have a different development than a different kiddo in the family too.
For sure. It gets into a lot right there, right? Whether you got older siblings, are you the youngest, or everybody taking care of you? Are you the only child where, you have more independent, whatever it is, those are definitely factors.
And then also if there's events that happen in your family. So you've kind of talked about how as the younger they are, the more concrete they are, the older they get, the more ability they have to have empathy and understand gray area. And that can affect what they understand or how they react to what's going around them. I think that also can affect what parents choose to talk to them about or share with them or expect from them. Certainly as that goes into those teenage years and beginning of post-high school, even though they are in their teens, they're not grown, as you said, not till 25. So they may think they know everything or want to know more, but may not also be ready. So are there things that, like when we're talking about mental health and when parents are trying to decide, is this normal for my kid? Is this normal development that Kevin just told us about? Or should I be concerned? How does somebody know? Like, how does a parent or family member or guardian know, okay, now I need to reach out to an expert? What are some of the things that families should watch for?
Well, and that gets a little complicated. Are we talking about an academic part about, language development, spelling different, those kind of tasks versus, what are we talking about developmentally appropriate, emotional regulation, coping skill strategies, ability to express self, be able to get feedback, those kind of things, which I'll kind of focus on that. I would say that to me, in my experience, what I tell parents all the time is look for major changes in behavior and mood. If it's just really out of the norm for your child, like they're starting to have big emotional outbursts or shouting, violent reactions, and that's a signal of something deeper, more than likely. Or I don't know, running away. Their eating habits have changed. Now they're eating less or more, or sleep patterns are getting rocked, or maybe you had a very outgoing child, now they're becoming more isolation type, or they're avoiding stuff and all that. Those are, to me, the flags that tell me as a parent, if I see that and I'm being very present and I recognize that shift, I need to have an open, honest conversation with my child to check in and say, hey, you okay? What's going on here? And really not just waiting for them to come to us, but being the driving force of recognition that something has shifted here, trusting yourself about that something's different with your child.
I often will talk to parents about even older children, teenagers, when a kiddo is maybe a toddler and we as parents know they missed their nap or they haven't eaten yet today, and so they're crabby and they're having a tantrum. We get that. We understand that because we know that kiddo is used to that structure. And they may not, they may be acting out and may not even know why. I think that's also true with adults and also true with older kids, that they may be acting crabby or defiant, but there also might be something else going on with them in addition to that they may not even realize what the trigger is. And so that's, I think, when you said, trust your gut as a parent, look for changes. If you have a kid that's not usually outgoing and they're still not outgoing, that's not a change. But if you see them now, they're not hanging out with their friends, or they're having usually they're a good student and now they're not. I think the other thing that's important is that parents don't have to be experts. They just need to know what their resources are. And so in a second, we're going to talk about some of the resources that PASS has to offer for families. But you also said that keep engaged. I think you mentioned that, stay engaged, be able to keep that open line of communication. I always tell the parents, don't freak out, go freak out in private, but, keep your game face on so that kiddo keeps wanting to talk to you and keep sharing, because I'd rather they tell you things than keep it from you because you're going to get upset or not like it.
I would agree. And I do think that as parents, we got to recognize, that's why I'm a very trauma-informed person, because we all come with that, right? And then certain things still react for us. We got triggers as parents, and we often want our children to do something different than we're even able to manage ourselves. And it's out of the place that we want it to be better for them, but we got to recognize that we have to be the model, and we have to deal with some of our own issues and at least identify that we're reacting to them so that we can pause and respond in the way that we want healthily to our child. I always say, if a child keeps doing a behavior or something that you keep getting on them about, telling them they need to stop doing that or do it, you got to think of it as a skill set, that they need taught the skill.
Yeah.
So how can we teach the skill if we don't want them yelling and screaming at us, right? As a defiant behavior, for example, then guess what? we probably need to really think about if I'm yelling and reacting and dysregulated and showing that kind of frustration when they're not complying or I'm not in control, we're not modeling the exact skill that we want them to show us. And so that's where it's like there's a combo, and that's where we get into some therapy. Like, when I work with parents, it's not as simple as like, give me your child and let me fix that. Sometimes it's the recognition of their age level, right? Of what we're talking about. When you're young at 3, 4, 5, you need play and you need experience in an interaction way that as a primary parent, you're going to have the biggest role to do that. I can, as a clinician, teach you some skills of how to do that and support your child versus a 12-year-old that can process with me, right? Or a 8-year-old or whatever, very different in that aspect. I just say for parents, the one thing I can say is, learn how to actively listening to your child, manage your own emotions and model skills that you want. Remember how the importance of praising the behavior you want and the effort that you see versus always pointing out the negative of what they're not doing. Because if we're really trying to encourage exploration, self-reliance and adaptation and resiliency, that's what we're looking for, encouraging the effort and the ability to change.
I say that to parents often. We know as adults how difficult change can be. If I want to change a habit, it's not easy to change. And if I know it's hard, it's going to be even harder for a kiddo because they have to be committed to that and do that. I also say, that whole do as I say, not as I do, that doesn't work. So as you said, we have to do it. So we have to model it, as you said. When you talk about like different ages and stages and cognitive ability, one of the questions we get a lot is about, does PASS see kids for counseling? And so I wanted to ask you about, what is counseling like for children versus counseling for adults? Or what can you share about that in that process?
Well, this is once again my clinical view. I'm sure other people have some maybe different ones, but we're always at PASS willing to assess and support families, give information, meet with a parent and a child even together, or whatever they may look like, to kind of determine how we might be able to give them resources or refer them to the appropriate thing that might do it, or if it's something we can do in a short-term solution model, we'll do that with them. The challenges, I think, get to be, it does matter with age stuff a little bit, right? If I'm dealing with a 4-year-old, we've talked about language development. We still got to sequence the language that has to develop before they can really do some of the insightful kind of therapy work where you can reflect on your own stuff. Like, we're just in a teaching of a sequence language so that we can use the building blocks to identify a feeling, then to be able to put a label on it, then to come up with a coping strategy of how we're going to manage and calm ourselves down, right? This is a whole process. So if I was working with a parent with a very young child like that, realistically, that's more like play therapy kind of thing, right? That's a more specialized place because they're doing interaction style, learning through play, learning through the experience of play. And so I would encourage a parent in that situation, like if we were talking, I would give them some ideas about how they could interact with their child and play to develop some of these language things or whatever we're talking about. Where then when you start getting up to like eight-ish, right, you can really begin to do some really hard, more cognitive behavioral work because they can identify the thought, feeling, connection process. So I can do a lot more of that interaction, that insightful kind of therapy, because they're able to reflect on that, where the younger ones can't do that. So those are different, where I wouldn't necessarily need the parent as much to do some individual with that child. But I still am a firm believer, that parents are the number one critical impact for their child, who make the biggest impact. And the more they can adapt and do things to support their children, the healthier it's going to be. The leaps and bounds of the difference that we see in children by taking some of those skills or whatever that is, and then applying them and really using them in your life and the family system.
It sounds like what you're sharing here is that EAP counseling is more that insightful therapy. It's more cognitive behavioral. It's talk therapy with a person to talk about identifying patterns, changing coping mechanisms, and applying that in real life. And so if somebody in a family, a parent said, I have a 5-year-old and grandma passed away and I'd like to have the 5-year-old come for grief counseling, we may say, EAP is not the best place for that, because what you just said is they're not ready to have talk therapy, but because of how we do talk therapy. But what you're telling me, though, is that we definitely do work with families and family counseling. We also can meet with a family to give them resources. We can meet with the family and the child to do some assessment, but also connect them with resources in the community who do specialize in that play therapy aspect that could take as much time as they need. So that's a question I think that comes up a lot. Tell me about, at PASS, we also kind of address that in different ways with other resources. So I just kind of talked about, and you and I both talked about this, the family counseling and the assessment and referral and meeting with them when we can. What about other resources that PASS has to support families in these circumstances?
Well, I mean, one is like you just said in the example with the 5-year-old. I mean, we can provide that assessment, and it may be as simple as, I say simple, but talking to the parents, supporting them, helping them process, giving them some ideas to work with their child might be very impactful in the situation, for that 5-year-old, right? But then there's other things we can do. If it's not something that we can do in the short term kind of thing, we can definitely give resources to parents. We've got parenting consultations here that we have as a service through EAP that we can link them to. We have 24-hour support line, 24 hours a day, 7 days a week, where you can get in the moment. We have education planning kind of pieces. We've got blogs and information on our website that can be helpful for families looking for some resource. There's legal resources with PASS. We have a variety of things, and we have a lot of people with a lot of knowledge base that can benefit families, parents, and get them in the direction of where they need to go, regardless of whether that child is something that we could actually do over what we were talking about, actual therapeutic wise. We still have all these other available options of what we can do to be helpful.
I appreciate that. I find, and you may know better than I do, that sometimes parents, they are seeing something, but they just don't know what direction to go. So they don't have to have the answers of what they need. Are you saying, is it fine if they just call in and say, here's what I have going on, and the contact center clinicians can help navigate them on what resources are available?
Yes, they can call PASS and at least talk to a master's level to kind of process and figure out maybe what would be best for them, their family, their child. And I have those conversations sometimes because, the reality is sometimes with these young kids in a short-term model, right, it can take a very long time. It can take 2 to 3 sessions to build some therapeutic alliance and rapport with the child. Well, I want to have honest conversation. What does that look like if they're starting 3 with this and then they have to go to long term and then change a clinician? Like, that has a ripple, right? So we talk about those things, not just so that information and knowledge is powerful. I believe in self-determination. Give the information and let people who it impacts be the determining factor on what it is that they want to do with that.
We've talked a lot today about counseling, which is important because mental health, and that was our goal today. There definitely have been fewer resources nationwide in resources. We hear from a lot of folks that I can't find somebody who doesn't have a waiting list. And so that's another way that we can really help with families, because we have a good network and we are aware of people that do what they do. And so sometimes it's just helping families find directions. The other thing, in addition to counseling, that's also important, and you mentioned this too, is what we call our life management services. So our life management services, like you mentioned, the parenting consultant, our life management services are all over the phone. We do a warm connection with those coaches and consultants also. And so like the parenting consultant works on learning concerns, discipline, developmental milestones. And so they can work with a family individually on what's going on with them. We have a homeschool specialist that can talk about homeschooling. We have daycare resources. We have folks that can help find day camp and summer camp. And that's the other thing that I think is important that we wanted to make sure that people knew, is how many resources are available to families. Sometimes they think, oh, well, you won't see my 5-year-old, so you can't help me. And that's really not true. So we have a lot of ways that we try to connect and give them the best way to meet their needs. As we get ready to finish up here, Kevin, first, I would really want to thank you. You have so much expertise. I think we definitely will meet again and maybe talk We could have gone so much deeper in so many of these topics. So I think we can choose one or two to do again. Is there anything as we finish, and I'm totally putting you on the spot, anything overall as a message you want to share with parents about child mental health or adolescent mental health? Just an overview or just a quick note?
Just a quick note. I mean, I guess I'll throw this one out there, when we're talking about children. Think about what a function of behavior is of a child. Children typically are doing a function of behavior for attention, escape, access to tangibles like an item or something, or sensory needs. And if we can start seeing what they're doing as a way to get what they want or to do what they do, maybe that'll soften the blow of what we're reacting to sometimes by being able to hold it, that this is just part of the boundary pushing, part of the boundary development, and all of that, and all that it takes to, raise children and be that guide and do all that. It's not easy, and a place like PASS offers a lot of support to that. And like you just said, on the life management, it may not be dealing directly with your child, but if we can help you lower a legal issue or a financial issue or something with daycare stress or whatever that may be, that's less stress off your plate where you can be available in your life. And so I'm always a promoter of self-care. I'm always going to push that. Choose yourself, and you're deserving of doing something good.
That's great. Thank you so much for being here today. I appreciate your expertise on this topic and for being here for our Passport to Wellbeing. Have a great day.
We've come to the end of our current journey, but we want to remind you that you can always find more information about the PASS benefit by visiting mypasseap.com or the MyPass app, or by calling our contact center at 1-800-356-0845. Until next time, remember, PASS is here to assist you on your own journey to well-being.